As medical students, as future healthcare professionals, our duty of care not only includes the future of our individual patients, but also to inform the public about medical topics that are interested in. Today, we will speak about COVID-19. The motive of this video is the dramatic misinformation given by the media in all aspects of COVID-19. We are humans. We have human rights. We have the right to know the truth.
COVID-19 is an infectious disease caused by the most recently discovered coronavirus. Coronavirus is a family of viruses that lead to infections in both animals and humans. In humans, coronavirus leads to respiratory disease that ranges from a common cold to much more severe respiratory affection.
The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. These signs and symptoms of COVID-19 may appear 2 to 14 days after exposure. That's why the quarantine's duration should be minimum 2 weeks.
These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing.
The disease is spread from person to person through small droplets from the nose or mouth, which are spread when persons with the COVID-19 coughs or exhales.
These droplets land on objects and surfaces surrounding the person. Other people can then catch COVID-19 by touching these objects or surfaces and then touching their eyes, nose or mouth. Moreover, there's no evidence that animals can infect humans.
Older people and people with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer and diabetes appear to develop serious illness more often than others.
Stay more than 1 meter away from a person who is sick.
Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water.
Avoid touching your eyes, nose and mouth.
Make sure you and the people around you practice good respiratory hygiene. This means covering your mouth and nose when you sneeze or cough using your bent elbow or a tissue. Afterwards, dispose of the tissue and wash your hands.
Concluding, WHO, the World Health Organization, declared COVID-19 a pandemic for the better future of the public health. Stressing about the new coronavirus will change nothing in the country's response actions, but only worsen your own mental health. As medical students from all over the world, we recommend to follow the policies of your country and the protective measures we mentioned in order to have better quality of life in the next few weeks.